The FDA receives more than 100,000 U.S. reports each year associated with a suspected medication error. In letters to state regulatory boards and in interviews with the New York Times, many pharmacists at companies like CVS, Rite Aid, and Walgreens described understaffed and chaotic workplaces where they said it had become difficult to perform their job safely, putting the public at risk of medication errors. The unethical business tactics that these companies use to maximize profit have resulted in an increase of medication errors, dispensation of unsafe amounts of medication to high-risk patients against doctors' orders, and serious harm and death. Regulations need to exist that prevent big pharmacy corporations enforcing dangerous business tactics that intimidate and place pressure on pharmacists to exceed performance metrics, demanding that they do dozens of tasks at the same time, impeding on their ability to perform their job and dispense prescriptions safely. Mistakes due to human error are inevitable, but with ever-increasing influx of unreasonable demands by corporations like CVS and Walgreens, every individual in the healthcare industry that is at risk of being involved in making an unintentional error can result in serious harm to a patient. The biggest chain pharmacies are often the most aggressive and intimidating when it comes to imposing metrics. According to a recent survey by the Missouri State Board of Pharmacy, hundreds of pharmacists said that they felt pressure to meet metrics that may interfere with patient care. Dozens of pharmacists said the same thing said the same survey that the focus on metrics was a threat to patient safety and their own job security. Nearly everything is tracked and scrutinized. Phone calls to patients, the time it takes to fill a prescription, the number of immunizations given, and the number of customers signing up for 90-day supplies of medications, to name a few. The fact that tasks are being tracked is not the problem, pharmacists say, as customers can benefit from services like reminders for flu shots and refills. The issue is that employees are heavily evaluated on hitting targets, including in areas they cannot control. Working as a pharmacy technician for CVS for over 5 years, I can personally attest to the unsafe work conditions that higher management allows for the sake of profit. In comments to state boards and interviews with the Times, pharmacists explained how staffing cuts had led to longer shifts, often with no break to use the restroom or eat. A complaint made by a pharmacist to the Oklahoma State Board of Pharmacy stated, "I believe the pursuit of profits within CVS Pharmacy has reached a critical point where the lives and health of their patients are being put in danger regularly." Pharmacists are tasked to perform various tasks during the day that far exceed simply filling prescriptions, and the board believes that cutting down on pharmacists' work hours is key to minimizing strain. A 2007 study from the Ohio State University estimates 2.2 million dispensing errors occur nationally every year. This translates to approximately 1 dispensing error for every 1,750 prescriptions dispensed. In 2003, a study from Auburn University found that pharmacies processing more than 250 prescriptions a day made 4 errors daily. Big pharmacy companies like CVS and Walgreens say they use these metrics to increase patient adherence, but they are actually adversely affecting almost every aspect of healthcare. Doctors are inundated with refill requests by pharmacies for almost every prescription written, even when the medication is intended for short-term use. Overwhelmed by the constant calls by pharmacies and the unnecessary work that this creates, patients are often kept on unneeded medication for extended periods of time. Pharmacists told the Times that many unwanted refill requests were generated by automated systems designed in part to increase sales. Others were the result of phone calls from pharmacists who said they faced pressure to reach quotas. Lately, CVS has begun pushing 90-day prescriptions on patients to drive profits even for certain drugs for which it is inappropriate. This can pose a serious safety risk. For instance, lithium is a drug commonly prescribed for bipolar disorder and often written explicitly by doctors for only monthly dispensations. CVS is accused of ignoring these directions blatantly and allowing high-risk patients to possess an excess supply of lithium, which they can use to possibly commit suicide. The U.S. FDA the FDA MedWatch shows reported medication errors have increased by 450% since 2010. Pharmacist Steve Luick describes the incidence of a patient receiving a misfilled prescription as an individual that has won the pharmacy lottery. If the patient then consumes the medication as prescribed, the results may be less than ideal, quite often serious and sometimes fatal. Unless state boards are able or willing to regulate this kind of behavior by these corporations, every patient that fills a prescription at their local pharmacy is at risk for being the unlucky lottery winner.